This is Brent of the Brook Bush Institute, and in this video we're going over manual therapy techniques, specifically instrument-assisted soft tissue mobilization. Now, if you're watching this video, I'm assuming that you are a licensed medical professional with instrument-assisted soft tissue mobilization within your scope of practice. Now, there's some gray area here. Not every state has legislation around these tools. If you're not sure, check. I would hate to see somebody getting in trouble because they watched one of our videos and used it on a patient or client when things did not fall within their scope of practice act. Now, these tools, just like all of our other techniques, fall within a model of practice, and we are very big on assess, address, reassess. So even though these tools are specific to perhaps fascial tissue, we're still going to base their use on reliable assessments. We're going to use these techniques, and then we're going to reassess, and if they're not effective, we're not going to use them again for that particular patient or problem. In this video, we're doing the anterior and medial fascia lata. That's the front and inner fascia of the thigh. I'm going to have my friend Lisa step out. She's going to help me demonstrate. Now, Lisa's going to lie supine. She's going to scoot as close as she can to the side of the table, closer to me. That's going to make things a little easier. And then you guys will notice that I have her in some pretty loose shorts. That's so that I can pull her shorts up so I can see all of her thigh. Right? I want to get all the way up to like the insertion of maybe her rectus femoris and where that fascia lata kind of blends into the inguinal ligament, right? Which would be the end of the fascia lata. And then for modesty's sakes, guys, you might ask them to go ahead and tuck their shorts underneath their underwear, if you don't mind doing that for me, Lisa. So just kind of tuck under the border there. And what that'll do is pin down their shorts so that nothing shows as we're moving around the leg. Just a little modesty tip for you guys. Now, of course, we're going to use a little bit of this lotion here because we want to make sure that we kind of protect the skin. That the idea is not to just scratch the heck out of the skin. I know a lot of you guys are used to seeing videos with the really red petechiae, but what we're really trying to affect is the fascial layers underneath that. So I just have a little bit of this Smart Tools cream here. Put it on the end of this clean tool, and then I'm going to go ahead and rub it in so that we get this lubricant all over. All right, and you guys can use your hands, and my manual therapists out there, like, this is a good time to start getting a little bit of an assessment going on what you think might be tight. All right, so I can feel she's a little tighter down here towards the knee. All right, so maybe that end of the rectus femoris has some trigger points in it, or who knows, maybe her articularis genu. Right, and then her inner thigh is just a little tight here. I know some people get really bent out of shape about using too much of this cream or too little. I don't generally worry about it much. If you have extra, you can just go ahead and moisturize their other thigh. Most people are not going to complain about it. Right? So the first thing we're going to do now is we're going to scan. We want to scan the whole thigh. And what we're going to try to note in our heads is areas where things don't feel uniform. Usually that's a little extra roughness or a little bumpiness. So I'm just going to go ahead and take this tool here, guys, and this tool is this scanner. It's a single bevel. It's pretty sharp, right? So we don't need that much force. I'm just going to go ahead and hold it to like 20 to 30 degree angle. Go right up to the point where I'm getting a little bit of pushback from her muscle tissue. And then I'm just going to kind of drag through. And what I noticed right away is I got a little bit more bumpiness here and a little bumpiness here. So we're going to keep that in mind. And now I'm just going to kind of keep going. Just one row at a time, almost like I'm mowing a lawn. All right, just kind of keeping track of where those bumpy areas are. Again, it was like in here and in here. I'm going to keep going up. And guys, I'm going to go ahead and stop before I hit the side of the thigh because there's actually a different position I would use for doing all of the lateral fascia lata. All right, so we'll go through here. All right, so now I've scanned the tissue and I feel like there might be a little bit of fascial dysfunction here and here. The theory that probably makes the most sense for these particular tools is this idea that when we get some tissue damage, all right, or tissue dysfunction, that we end up with binding of our fascial layers. So what we're going to try to do is kind of break up the collagen cross-bridging, the disorderly collagen cross-bridging. We're going to switch from this sharper tool And I'm actually going to go with this handlebar tool since the thigh is a pretty large area to go after, right? We're going to start going in one direction with the tool. Same thing, it's the same kind of strokes we were using for scanning, only now I don't just want to go in one direction. Because I think I mentioned in previous videos that your fascia doesn't align with the direction of muscles. So it's not like because we're on the thigh, the fascia lines up this way. The truth is the fascia lata is multi-layered, and those layers are crisscrossed. Right? So we have the natural fascial lines go in a bunch of different directions, not to mention the disordered collagen is going in all sorts of directions. So we want to start maybe going up like this, the way I felt the bumpiness, but now I'm going to mix it up and go all sorts of different ways. So maybe I go down for a few strokes too. And it just takes like 5, 6, maybe 7 strokes in each direction, maybe less, maybe just 3 strokes. The next thing I'm going to do is I'm going to try to get some angles. So what I like to do is kind of think about fulcrum and then spin it around this way, right? So I'll get that diagonal, then I'll switch it around and go that diagonal, and I'll go that diagonal, I'll go this diagonal, right? And I've already done 6 directions, right? That's a fair amount of therapy. That's probably a good 20 or 30 strokes in that one area. And I would probably leave it at that and go on to the next area. So now we have close to the knee. Again, I might go down. I'm using just kind of like a little scooping stroke, or you can just pull down just like you were using those scanning strokes. Up this way, same thing. Just going right up against the muscle tissue and then pulling this way, trying to shear some of that fascial tissue with me. Again, we'll go this way. We'll go this way, this way, this way, this way, this way. Good, and now we got that area completed. Now if you wanted to frame the knee, right? So framing is where we kind of go around a bone, or we go around a ligamentous tissue, make sure that everything is freed up around that. If you guys wanted to do that at the knee, you could. We could go around the patella a little bit. Right, if we felt some dysfunction there. It's a little harder to do multiple directions, but try. Right, so I'm just using this shark fin tool here. It better fits this space, and I'm getting right up against the patella. And what I'm actually doing is kind of falling off the patella and then going away from it. If you're going to go towards it, just make sure you use your thumb to kind of block it out. And then maybe I'll use the tip of the shark tool to kind of go sideways, kind of like some cross friction, just to get some different directions. Now after I've done that, maybe the next thing I want to do is if I've noticed any trigger points, especially if I was doing my manual therapy first, which I usually do. I usually do my manual therapy first because once you get the lotion on, it's a little harder to do the manual therapy. But let's say I noticed a trigger point right here. I could come back and kind of break up any binding of that connective tissue around the trigger point that I thought might exist. I have noticed that attacking trigger points like this helps carry over a little bit. So these trigger points tend to become a lot less sensitive and start to disappear a lot faster when I do my static manual release techniques and then follow it up with a little bit of this. And then of course the last thing I'm going to do is we're going to get a little bit more functional with this, and I'm going to do a little pin and stretch, or at least IASTM's version of pin and stretch. So I could take this tool, just have her bring her leg this way, and now she's going to hold it for me for a sec. I'm going to go right back over where that area was a little dysfunctional. I'm going to grab some tissue, and then I'm going to have her try to let her leg down. Good, go ahead and let it all the way down. All right, so I've pinned that tissue, and she just pulled all that muscle tissue through where I've pinned the fascia. We can do that again. Guys, this is a very aggressive technique, so you only need a few reps. Go down again for me. If I did want to get a little bit more aggressive than this, I could pin, and then as she's going down, go ahead, I can pull through the tissue. If I wanted to get more aggressive than that, I could pin, have her slowly let down, go through the tissue, and apply overpressure. And I'm sure she's thinking that's pretty intense. All right, so we just did the front of the thigh, and literally that would be an entire treatment, guys. It doesn't take much of this stuff. I think the biggest mistake that gets made with IASTM is people go really, really hard and leave a lot of bruising and stuff behind. The inner thigh, we're gonna use the exact same techniques, right? So I'm gonna put her in this position, right? So this is the same position we've used for like some adductor release manually, but it gives me nice access this way. I could use my scanning tool. All right, so I'll come through here, notice any bumpy areas. So I notice a little bit of bumpiness this way, a little bit of bumpiness over here. Of course, once I find the bumpiness, I can go back and do my strokes in different directions. If I had been working with her manually on her adductors before, I could go after any trigger points that I find. And then I could follow that up with, again, a little bit of pin and stretch, some more dynamic instrument-assisted soft tissue mobilization. And all I'm gonna do is, I'm gonna help her out here a little bit with my stomach, pin a little bit of tissue, and then I'm gonna have her think about driving her knee down towards the floor. Perfect. All right, and I could do that a few times. Be careful with the inner thigh, guys. Inner thigh is a very sensitive region to be doing instrument-assisted soft tissue mobilization on. How's that feel, Lisa? Fine? Good. I am trying to be a little easy on Lisa as we've done a few takes, right, to make sure we got you guys a nice, clear video. But there you guys have it, anterior and medial fascia lata, right? So we did this position. You got this position for the dynamic, this position for adductors, and then dynamic would just be this way with the adductors. Guys, stay tuned for your close-up recap. All right, guys, for our close-up recap, we're gonna use a little bit of the Smart Tools cream, get that skin a little lubricated so that we're not just abrading the skin as we're trying to do fascial techniques. Now, of course, as I'm rubbing this in, personally as a manual therapist, I'm taking in some information on where I feel some extra tissue density. You know, maybe that's somewhere I might expect to feel something as I pull the tool through the layers of fascia. Right, now I'm using this scanning tool to start off with, guys. It's single beveled, it's pretty sharp, relatively speaking. And I'm gonna go ahead and take it at 20 to 30 degrees here, and I'm just gonna start from the bottom very systematically and work my way through all of this tissue, noting any discrepancies. All right, so anything that feels abnormal to me. All right, and I feel a little bit of extra tissue stuff there, a little extra bumpiness. I also feel a lot of extra, now that I'm going through this, I'm noting that like every time I start, this is much more restricted, much more bumpy than the rest of it. So let's say I've gone through all the tissue, all the way from inguinal ligament, all the way down to the knee, and I noticed here and here. Of course, now I want to do those multi-directional strokes. I probably wouldn't use the scanning tool for that. You could, but this sharp edge, which makes it great for feeling through the tissue, is also pretty aggressive. Maybe I'll try using this double beveled batarang looking tool from Smart Tools. And again, I could go down strokes. I notice I'm using the same angle. 30 degrees, pull down. 30 degrees, pull down. And I can go up this way. Pull up. You guys notice there's some redness already. So if I see redness that quick, you know, we're looking at like 3 to 6 strokes per direction, probably gonna lean towards 3. Because I also wanna go maybe in this direction, and this direction, and this direction. This direction, right? I don't want to get stuck where I've gone all in one direction and now I've already got so much redness, so much of a histamine response, maybe so much petechiae that I know if I do any more, I'm just going to lead to bruising. All right, so keep your eye on how red things become, how fast. Now, of course, I could do this area, same thing, up, down. Of course, if we're talking about a larger area here, I can switch my tool to something like the handlebar tool. Right, and get a lot more area done, go through a lot of different directions. Right. Once I get through that, maybe I'm going to go back through and do my trigger points. So any trigger points I noticed while I was doing my manual therapy, I could then do that like cross friction-y in all directions around the trigger point that I had mentioned. Really helps with carryover. And then we always want to get a little bit of that pin and stretch in and really work on improving range of motion. So we started down here at the knee. All I'm going to have Lisa do is hang her leg off the table, pin, and then just let her sink her leg down, right? So now as the weight of her lower leg is pulling all that muscle tissue and those deeper layers of fascia through the pinned tissue. All right, so let's try that again. We'll do 3 reps there. Good, so I got pinned up. All right, let it go. Of course, if I want to be more aggressive, I could have actually pulled through as she was going down. All right, so I could pull through, go ahead and let your leg go, and go against it, kind of against the grain there. And then of course, if I really wanted to get aggressive, I could add overpressure with my knee and push her further into flexion. Now we also did the adductors, right? So adductors, I mentioned that this was probably the best position. And note that this area is very tender, guys. Like adductors are just a sensitive area to do manual therapy on. They're sensitive for instrument-assisted soft tissue mobilization. Keep that in mind as you're going through the adductors. Don't start off real aggressive, but I'm gonna do the same thing. I'm gonna scan. Once I find some really tissue that I think is dysfunctional, more bumpy, more restricted, I'll do my multi-directional strokes. All right, so maybe it's right around her adductor magnus that we see here. Let's see, she's getting red pretty quick. All right, that's not an abnormal amount of redness, that's probably fairly normal. And then, of course, we'll make sure we get a little bit of mobility in there, but I'm gonna hold up her leg a little bit, pin the tissue, and then I'm gonna have her think about, as I kind of let my leg go, which is holding her leg up, I'm gonna kind of let my leg go and have her press her knee down as I'm pinning this tissue. And then I can use the same methodology there. So I can have her pull down and pull through if I want to get a little bit more aggressive, and I can get really aggressive by having her pull down and pull through, and then maybe adding a little bit of overpressure. So there you guys have it. Instrument-assisted soft tissue mobilization for the anterior and medial fascia lata, or fascia of the thigh. So there you have it, instrument-assisted soft tissue mobilization. Make sure to assess, address, using the intervention, and then of course reassess. And if you get the chance, these videos are not a replacement for live education. Of course, if you get the chance, you should take live workshops or find a mentor who's experienced using these tools, or maybe a friend that wants to learn them too, so at least you can practice on each other and give each other some tactile feedback of what you feel, how you felt the next day, what results you felt that you got. I hope you guys enjoyed this video. Please feel free to leave your questions below.